Our next speaker is Dr. Josemier Mattei. Josie is the Donald and Sue Pritzker Associate Professor of Nutrition at the Department of Nutrition at the Harvard T.H. Chan School of Public Health. She investigates genetic, dietary, and psychosocial determinants of cardiometabolic diseases in racial, ethnic groups and underserved populations. Josie is the principal investigator of the PROSPECT study funded by the NIH and currently out in the field in Puerto Rico conducting an island-wide survey. Let me point out that the PROSPECT study has shown some resilience because it survived both Maria and it seems to be surviving COVID-19 at this point. Josie?
Good afternoon. Thank you to Centro for inviting me to present today. I am Dr. Josemier Mattei, currently at the Harvard Chan School. Our research group studies the lifestyle and psychosocial risk factors of chronic diseases among Latinos in the United States and in Puerto Rico. Today, I will be sharing results on the emotional health among adults in Puerto Rico during the COVID pandemic, collected from the PROSPECT cohort. And we will be specifically focusing on feelings of depression, anxiety, and stress. To begin with, we must note that emotional health was concerning in Puerto Rico even before the pandemic. In 2015, we conducted a cross-sectional study among nearly 400 adults in the San Juan metro area and asked about emotional health. 23% reported having anxiety at the moment, 18% reported having depression based on a given medical diagnosis. That is 1 in 5 adults struggling with negative emotional feelings. More astonishing was the fact that more than half of the participants had a score indicative of having likely depression according to a symptoms-based questionnaire. The contributors to emotional well-being are multifactorial. In Puerto Rico, social and individual stressors are quite widespread. Unemployment rates are hovering the 15%. Socioeconomic limitations prevail, with nearly half of the population experiencing poverty. The last few years have been defined by political and social instability, high crime rates, violence, and of course, massive natural disasters. So Puerto Rico was already in what I call a pressure cooker. And then the COVID-19 pandemic hit. So this is where we had a natural opportunity to track emotional well-being in the island. The PROSPECT cohort is a longitudinal study on lifestyle and psychosocial risk factors in Puerto Rico. The study is conducted across the whole island and started in 2019, pre-pandemic, with the goal of recruiting 2,000 adults. Our initial recruitment and intervention strategies were done in person by visiting households to invite potential participants who came into one of our 55 partner clinics for an in-person interview and biological measurements. And that included a full battery of mental health questions. In March 16, 2020, we had to stop all protocols due to COVID-19 closures. Later in August 2020, we resumed PROSPECT using alternative methods for with safety precautions and for phone or video calls. But in that period in between, we took an opportunity to probe COVID-19 related factors. In April 15th, we started calling participants to ask questions on COVID-19 exposures, symptoms, testing, and diagnosis, as well as questions on emotional, mental health, food access, medical diagnosis, and changes in lifestyle habits during the pandemic. We used proxy single item questions for emotional health that were previously validated against full symptom scales for the sake of brevity. Participants responded at the first contact and those responses were established. Then we called them weekly until July to assess any changes from that initial call. We had 566 PROSPECT participants as of March 16 when we paused the study, and 86% of them completed the baseline COVID-19 survey. And that is the data that I will show today. Nearly 75% of participants follow up for at least 5 weeks, and 42% had 10 or more weeks of surveillance data. There were minimal changes tracked over time. Fortunately, only one participant reported testing positive for COVID-19. So sharing some results, first we observed that the majority of participants felt informed on COVID and were following the physical distancing guidelines while still trying to stay socially connected through other channels. However, fears remain, mostly a fear of getting or dying from COVID. I mentioned that only one participant reported a positive COVID test, yet shown in blue, we observed that 41% experienced at least one COVID-19 symptom, either major or minor. 4% reported a major symptom. 20% sought medical care because of these symptoms. And in other COVID-related factors, 22% reported losing their job due to COVID, and 14% reported limiting their food due to lack of money. So our next question was whether any of these behaviors and consequences were related to emotional well-being. First, we observed a significant increase in likelihood of feeling anxious from socially distancing. Now, I find that interesting because we originally thought that people who distanced more might have felt more safe and those be less anxious, but it seems that the opposite was happening. We also observed that reporting any COVID-19 symptom, major or minor, was associated with a doubling in likelihood of feeling anxious, depressed, or stressed. Being afraid of getting COVID-19 was nearly triple the odds of feeling depressed. Now, this is important because we had very few participants reporting major symptoms and just one confirmed case. So the emotional distress came from minor symptoms or even just the fear of getting them. Lastly, we noted 3 times the odds of feeling anxious and 4 times the odds of feeling stressed for those who had to limit food intake. So COVID may have exacerbated food purchasing power and access, which increased anxiety and stress. But what about changes in emotional health? Well, since we had pre-pandemic data in Prospect, we were able to identify adults with pre-existing emotional symptoms. First, among those without prior symptoms, there was a slight increase in anxiety and interesting, fewer reported feelings of depression. That is something that we're looking into more deeply. However, for those who had pre-pandemic emotional distress, additional feelings dramatically rose post-pandemic, suggesting a worsening in prevalence of adverse emotions. Further confirming this, after adjusting for socio-demographic factors, feelings of anxiety, depression, or stress were between 2 to 3 times higher for adults with pre-pandemic emotional distress compared to those without symptoms. So what are the takeaway messages? First, emotional distress remains a persistent concern in Puerto Rico. COVID-19 fears and consequences increased emotional distress, and adults having these feelings before the pandemic had worsening emotion during the pandemic. This raises the issue of remaining attentive to emotional health all the time. I include in the bottom a couple of comprehensive articles on evidence-based strategies to address mental health with multi-level approaches. I encourage you to check this out, but I would like to highlight a couple that might work well in Puerto Rico. First, a robust constant screening system for mental health, remote and in-person help services, such as the Linea Paz that operates in the island, and training stakeholders on how to respond to mental health crisis and avoiding stigma. Prospect was timely in collecting data to support these strategies, yet we need to ensure that these are applied at all times, not only when the pressure cooker is on. None of this work would have been possible without the effort of our phenomenal teams in Boston, our main partners in the island at FDI Clinical Research, and our collaborators at UMass Lowell, and the funds that have subsidized our projects. Thank you very much, and I will be glad to listen to your comments and questions.
Thank you, Dr. Mattei, for a really exciting presentation, and I truly appreciate your effort at making explicit connections of how the pandemic may impact psychosocial stress in ways that are not reflected when we look at the standard data, number of infections, number of deaths. At the end of your presentation, you tried to link your findings to potential policy solutions. So I know that this is all imperfect at this point, but based on your understanding of the problem, how would you prioritize possible interventions and make the case to policymakers about how they could begin to address the challenge of stress and depression symptomatology among the Puerto Rican population?
Thank you. That's an excellent question, Dr. Falcon. And my opinion is that this is such a pressing issue that we truly need to tackle it at all levels. Interventions policy is definitely a wider scope and a catch-all level to start with, but we should definitely consider this, including in healthcare, individual-based, and even at the community level. To answer your question for possible interventions, something that has been shown extremely well successful, especially during the pandemic across the globe in multiple countries, is continued screening at clinics and even through phone visits and telehealth to help identify the people who are showing emotional distress or who are at risk for such. So that is number one, and we have to continue that. And these programs are especially valuable for capturing vulnerable groups who are more likely to experience distress, but less likely to be screened in regular settings, such as low-income groups, older populations, and adolescents. And there are very quick and easy validated screeners that we can implement in clinical and community settings. So this is very feasible to do. Now, of course, I have to mention that the key here is to link these screening services to sustained mental health services. We can just not leave the people hanging after a potential diagnosis. Now, the second intervention that has really good potential, and this is especially important for the tight Puerto Rican community, and something that Kelsey previously alluded to, is the social connection programs. There's a very strong social connectivity and social network in the island and among our Puerto Rican community, so we can definitely take advantage of that. Community centers, volunteering groups, even walking and religious groups, these are very well-established social supports and network system that can blunt emotional distress. And finally, just to address your question on policy, first, if we keep collecting the data and making sure that we screen our population correctly, we can push further for policy changes with legislators and policymakers. So that's important to have that data to support this. But in terms of what to tackle first, my recommendation on what has shown a lot of results, positive results, is to tackle the upstream or the structural drivers of emotional distress. So some of these I alluded to in the presentation. First, stronger policies on crime and violence. Huge driver of emotional distress and something that we can strengthen. Improvements on the built environment and financial assistance, especially for food security. We saw that people who had food insecurity had more emotional distress. So providing assistance for food security and for safe housing are key. Now, super quickly, lastly, on all levels, something that we have to keep on working is to ensure that mental health is seen as a priority rather than as a stigma. So I hope that answers your question.
Thank you very much, Dr. Mattei. So what I would like to do now is go quickly over a number of sort of key takeaways from the presentations that we've heard today. And I think that something that it has become apparent is that the COVID-19 is not just a cause of significant problems in terms of mortality, in terms of potential impact on comorbidities, but it's also a compounder of inequities. In other words, that some of the ways that it's working into consequences for the Puerto Rican population has to do with existing inequities that may impact access, may impact language ability to communicate, access to resources, social networks, the impact that being unemployed or a family member in the family, family member losing a job. For example, access to food care and things of that, food insecurity, inequities that already were in place. What COVID-19 is essentially exposing and reproducing those same inequities during the pandemic. Some key takeaways that both have some implications for Puerto Rico is that COVID-19 is amplifying the already problematic challenges for the island in terms of the long-term economic crisis, the catastrophic effects of Hurricane Maria, the earthquakes that they experienced in 2019 and 2020. In general, during that whole period, a culture of neglect at the federal level, where efforts to support the island and fund efforts that would lead to getting the residents of Puerto Rico out of the crisis just went by the side of the road. There was essentially very little interest on investing in Puerto Rico. In addition, it has further exposed the structural deficiencies of the island's health system, became very apparent during Maria, partly when it came as to availability to electrical supply or to clean water. But the impact of that is now has also been experienced as part of the impact of COVID-19. Second, I think that some of the compounding of some of the health consequences due to the high incidence of comorbidities in the Puerto Rican population, both on the island and on the mainland, as has been documented by the BPRHS study in Boston and now by the Prospect study in Puerto Rico. Diabetes, cardiovascular disease, hypertension, obesity, the high incidence in the Puerto Rican population, those are all factors that have been associated with more significant consequences if you do experience a COVID infection. In addition, Dr. Mattei has been the point very clearly how you don't have to experience a COVID infection for COVID to have consequences on psychosocial stress, on symptomatology of depression, of indicators of stress in general, and a general sense of social isolation. So it's important to keep in mind that the impact may be indirect, but it's still considered to have an impact on the Puerto Rican population. Also, the pandemic has exacerbated challenges with access to medical care and food security. Food security both on the mainland and on the island, as we have reported in previous research, are a challenge for a significant percent of the Puerto Rican population. And then my next point has to do with sort of trying to understand the significance of some of the key points here. Essentially that COVID-19 cases, either death rates or cases in the general population truly do not capture, even the vaccination rates do not capture the impact on the population, the impact of the pandemic on subgroups within the population. As Natalie pointed out, the convergence of negative factors at higher levels in neighborhoods where Puerto Ricans and other minorities live have clearly has some serious consequences for rates of infection and for access to vaccination, which are significantly different from those of non-Hispanic white. Also, the point that I think it comes across all three of the presentations, that death, while it is a terrible outcome, is not the only consequence of the pandemic. This pandemic is going to impact way more people than those that we lost to the pandemic. And that vaccination is a way out of the pandemic itself, but it's not a way out of the byproducts of the pandemic. We need to keep in perspective that this pandemic will have not only physical but emotional consequences for this population, and that, as Josie Mattei pointed out in her presentation, we need to consider what are the critical interventions that we need to be made and prioritized in order to begin to address some of these challenges. There's essentially no literature right now on this problem, particularly when it comes to impact on Puerto Ricans. I did a search of the current literature. I found 3 publications at this point that talk about COVID and Puerto Ricans, and they're all in the similar stage to some of the presentations that we heard today, where data are being presented from symptoms that were registered back in summer or fall of next year before the intensification that we saw in the incidence of cases and increase in mortality that was experienced from November forward. So I hope that you keep in mind these key takeaways as we go into the section for questions. I will stop here so that we have an opportunity for those in the audience to ask questions of the panelists.
I would also like to invite our presenters, Dr. Mattei, Dr. Mangano, and soon I hope to be, we hope she'll be Dr. Natalie Rios, to come on the screen so we can ask a couple of questions of the audience. The first question is a question of clarification for Natalie. And the question reads, Natalie, are you referring to COVID positive cases and survivors to the COVID centers of excellence in New York City? So can you specify a little bit about specifically the population that you're analyzing? COVID positive cases and survivors to the COVID centers of excellence. That's question number one. Then there's also a couple of questions that are more broad that could apply both to the case in New York City as well as the case in Puerto Rico. It says, have you looked and found differences between Puerto Rican or Latino recently arrived to the United States compared with those who have been in the United States longer? So let's take those two questions. And Natalie, if you could please address the first question, and then Josemier and Natalie, you can address the second question. And then I have another question for Kelsey later on.
Yeah, no, the data is for all of New York City, and it comes from the Department of Health. So it's not as specifically from the COVID Centers of Excellence. So it's just data from the NYC Department of Health. I hope that's clear enough. I can also give more detail if needed.
Mm-hmm. And then in terms of the recency of migration, what impact might the recency of migration to the United States be reflected among Puerto Ricans and other Latinos, perhaps in New York City, and perhaps have we seen some differences as such, Dr. Mattei, in regards to Puerto Ricans on the island, in regards to migration? Natalie, if you may.
Yeah, so we unfortunately did not look at any data on how long people had been in the U.S. for. Just in general, like whether or not they were born here or not. I do suspect there is probably some challenges, like a lot of the vaccine sites are in like local community centers, so people don't have access to them or don't know about them. I can see that being a potential issue.
Dr. Mattei?
Yes, I'm going to quickly mention that in Prospect, we do track migration. We have not done that analysis yet. There was obviously very little move back and forth during COVID because of the travel restrictions in theory, but anecdotally, we know, and from tracking through other surveillance systems that I have been involved in the island, especially with the Ponce Health Sciences Institute School, we know that people were indeed traveling and had a lot of Puerto Ricans moving, especially from the Florida region back to the island when things got better, and then moving back to Florida when things got a little bit harsh in Puerto Rico. This needs to be documented much better, and that's something that we will be working on because we have the data, but I cannot unfortunately answer that question fully. I'm going to deflect this to Kelsey because I know that we do have more data on migration and back and forth in the Boston Puerto Rican study.
Okay. We are getting comments or questions from the audience asking if the slides will be posted on our website. And this is a reminder to all the members of the audience that yes, the entire webinar will be available after a couple of days for your viewing, as well as the individual presentations presented here. One question for Dr. Mangano. I couldn't help but think that the data, you know, you had 504 members in your samples, individuals in your sample, 7 had passed, 21 had become infected. This leaves proportions of about 1.4 deaths, based on a 504 sample, and then a 4% infection rate. How does that compare to other residents in the Boston area? So how do Puerto Ricans or how do Hispanics in the Boston area compare given these mortality as well as morbidity rates?
Well, thank you so much for the question. First, I'll quickly answer Josie's toss over to me that we did measure acculturation status in the Boston Puerto Rican Health Study, and we did not find acculturation status to differ between the small number of individuals who reported being COVID-19 positive and those who did not report experiencing the disease. That being said, we have a very low acculturation status in our population, so I'm not exactly sure if the comparison is fair, but we do have the data and we'll continue to follow up on that and report on that. So thank you for the question. And to answer the question regarding the rates of death and infection, I have to say I'm not exactly sure, and I don't know if, I don't mean to put you on the spot, but if Josie or Dr. Falcone have another I believe that death rate and infection rate is higher compared to other communities. To be honest, I haven't seen a lot of data published yet in other communities, so I'm not sure I can make a fair assessment.
Mm-hmm.
What we do know is that the rates are much higher, nearly double in the communities, and then Boston is divided in cities and towns, so it's very clear-cut rather than districts or regions. And in the cities and towns that are more populated by Latinos, and most of our communities are Dominican and Puerto Ricos, there's a doubling in infection rates than in the other cities, especially in the high-income cities.
And this raises, Dr. Falcone.
Yeah, no, I was going to say absolutely that Josie is correct. The rates for Latinos in Massachusetts are much higher than for non-Hispanic whites. And in fact, it caused the governor to change their strategy for vaccination at the state level and begin reallocating vaccinations to communities with high risk. They had done the same earlier on when they were doing testing for COVID. They reallocated resources. For example, the city of Lowell, every resident in the city was asked to go out for testing, even if they had symptoms or not. The same was done in Lawrence. So they targeted a few cities that had significant minority populations and said, let's test everyone and figure out who is contagious and who is not. Yeah. So there have been some efforts because there are significant disparities between Latinos and non-Latinos in the state.
Yeah, it's also interesting because, of course, there are two different trends that we may need to contend with, because on the one hand, there is this whole immigrant paradox in which immigrants into the United States tend to have healthier or better health outcomes than, say, Latinos or immigrants that have been in the United States for a longer period of time. But we have also seen a prevalence of or greater incidence of both morbidity and mortality among Latinos and, in this case, Puerto Ricans as well in the United States. At the same time, there is the whole issue, and one of the comments from the members of the audience is that age seems to be a much more salient variable. And we know that, for instance, in New York City, the Puerto Rican population is older than Puerto Ricans across the United States, but that is not necessarily the case in Massachusetts, where the Puerto Rican population is much younger than nationally. So I wondered to what extent age may have, to what extent age is an important variable to look at. We have seen that the mortality among the older cohorts is greater than among the younger cohorts, but then we have to look at the impact of workplace exposure, having to, be essential workers and things of this nature. And I open it up to anybody in the panel.
Well, a couple of points. One, I think age as a factor is critical because age has to do with the life cycle, and it sort of differentiates what your activities are at a given point in time. Take Massachusetts, for example. A lot of the mortality for the population 65 and above actually took place in assisted living facilities and retirement facilities, something that the Puerto Ricans in general tend not to have access to or the resources to be able to afford those. So the fact that Kelsey has found a fairly low incidence of COVID infection in the population, in some ways it speaks to the protectiveness of not being in a particular income bracket. On the other hand, what you're starting to see is significant rates of infections among the younger age groups in the population. And that has to do, one, that for some of the Latinos, particularly Puerto Ricans, they never left the job market. They continue working day in and day out. A number of them in the health sector, which is, I believe, the third largest employer in Massachusetts. A lot of them that were working in health facilities without protection continue working day in and day out. In the service sector, same thing. So they had more exposure to activities that could lead to higher rates of infection. So yes, age is a critical factor because it does expose you to different activities.
Quick adding to what Luis just said is that it was very interesting because Kelsey, for example, reported a much higher number of cases that were reported in the Boston, Puerto Rican, and that is an older cohort compared to our cohort in Puerto Rico, where the mean age was around 50, 51, 52 years old. So this is important, and it speaks precisely to that difference in age, even though the age structure in Puerto Rico tends to be older. And one quick reminder is that that was the situation a few months ago. And something that we have to remember is now in Puerto Rico, this is flipping. And most of the cases that we're seeing right now is actually in younger populations in the 20s and 30s, and even in adolescents. So that we have to be vigilant that yes, even though the pandemic started with mostly in the older generation and in the older population, this can shift, and this can shift at any moment.
Anybody else? Then a question for Dr. Mattei, and this is in regards to trauma, the trauma that COVID itself inflicted upon the population. But of course, as we all know, COVID is just the latest in a series of catastrophes affecting Puerto Rico. The earthquake swarms in the southwest coast of the island, both Hurricane Irma and Maria, prior to that, the economic crisis. And I know that the prospects started in 2015, but I wonder to what extent this, what cumulative effects on mental health there may be as a result, and how can that be captured?
Yes, it can be captured, and that is something that we are measuring. As I mentioned, we have a very solid and comprehensive battery of several emotional and mental health, and that includes post-traumatic stress syndrome, including reasons for that stress. Is it violence? Is it adverse childhood violence and crime or events? Or is it the events that have been happening in the society? So we will be able to track that throughout times. And I have to say, Prospect, as Luis said, has been a survivor among all of these. We started right after Maria, like right after.
Seem to have a technical delay.
Track throughout of this, and we even have data during the earthquakes. So we should be able to see how these things have been shifting. And the other thing that we have been measuring are biological markers of stress. So we have markers on cortisol, for example, both from urine, from hair, which are very strong markers. And we should be able to see if this indeed has been shifting throughout these events and how it has been shifting. And more importantly, we have positive measures, measures of positive emotional health, resiliency, coping mechanisms, social networks, social connectivity, which we think are very strong buffers of this distress. So that's something that we also want to see, because we know from qualitative work that we have done that this distress is happening, but at the same time, social support and resiliency is also increasing. And I think that's the positive message that we have to keep in mind, that yes, there is distress, but there are also strategies and mechanisms that we can pull from within our community to avoid that.
Another question that stems from a query from the audience is in regards to ancillary issues that may be affecting physical health and perhaps mental health. And this refers to food quality. what impact may food quality, whether in Puerto Rico or among Puerto Ricans in the United States, affect a person's health, and what interventions may there be to address the issue of food quality for the Puerto Rican population?
I can start and then turn it over to Dr. Mattei or anybody else who wants to add. We do know that food quality has a significant impact overall, pre, post, during pandemic on our immune response. So it's very plausible that poor dietary quality would lead to a poor immune response, which could in fact affect an individual's ability to recover from disease, certainly. And that's why we also asked questions in our Boston Puerto Rican health study surrounding food security. We know we have rates and unmet needs of food insecurity in our population. Interestingly, and I think not just in our cohort, we saw a shift due to the abundance of, at least in Massachusetts, the abundance of food that was required through assistance programs in the state immediately during that first summer following the initiation of the pandemic. However, some of those resources have now run out. And so we anticipate that with our follow-up study, we may see increases now in food insecurity among certain pockets, particularly among Puerto Ricans in Massachusetts. So that's certainly something that we're monitoring for.
I'll add very, very briefly. Yes, we are tracking changes in eating and especially responses to emotional eating. So we have specifically how people are responding to these emotions through eating behaviors. What I can say is something that Luis mentioned before and that we really have to stress is that whatever pandemics, whatever disaster happen, will exacerbate what is already happening in the island. So the issue is that in the island and in our Puerto Rican community, we already had poor diet quality, poor intake, a lot of nutritional deficiency, especially in important vitamins and minerals, and high food insecurity. Almost half of the population in Puerto Rico is receiving the equivalent to SNAP, so food assistance. So the situation is really that we have to pay attention to this at all times, because when something happens, it's just gonna make it worse. So yes, we have to respond now, but then we can just not drop the ball when COVID is gone or when the hurricane is over. We have to be vigilant and we have to have these policies in place for all times. And the thing that I will highly recommend to help improve this is widening food assistance coverage and ensuring that people have access to food assistance.
Thank you. As it tends to happen in presentations such as this, now there are many more questions that there's time to answer them all. But I invite all of our presenters to continue answering and responding to some of these questions in writing through the Q&A as we move on to the next presentation. But I am going to field one more question before we conclude this segment of the webinar, and it is regarding vaccines. Two related questions. One says, it seems to me that vaccines have been more accessible here on the island than in the US. Is that the case? Question number one. And then related to it is, aside from the general distrust minority populations have in getting the vaccine, do you find that the Johnson & Johnson pause affected Puerto Ricans and other minorities in getting the vaccine? Will there be any studies to compare minority populations' usage of the different vaccines? If anybody can answer those questions. And if you don't, that's fine.
I think I responded already in the Q&A to one of these questions, which was precisely about vaccine intent and vaccine hesitancy in the island. A very good colleague of mine, Dr. Andrea Lopez-Cepero, who is also a collaborator in the Prospect study, she did a population-wide survey precisely on vaccine hesitancy and intent in the island. And vaccine intent was really high. It was over 80%. Those results are gonna come over soon. I think that might explain why we're seeing more vaccination and higher vaccinations rate in the island than here. I cannot speak too much about whether we're receiving the vaccines or not, but definitely the hesitation, the intent is pretty high. Those results are gonna be published soon.
Anybody else?
Yeah, Carlos, I'm a sociologist, so I can always speculate. What I was going to say is that clearly conditions on the ground vary across the states. I mean, there are states where you can sign up for a vaccine and you are not going to be able to know what is being administered. So when you show up at the site, that they give you what they have. In Massachusetts, for example, there are large sites that you actually can choose the site based on the vaccine that they're providing. So there is some options to choose. Certainly, the J&J delay will have an impact across the board for the country. I think it will be hard to separate, and it was going to require perhaps data accessibility that we may or may not have from the CDC. I mean, the CDC is keeping records on the different types of vaccination administered. And I know in Massachusetts, for example, when you fill out the information for the vaccination, it asks you for identifiers on race and Hispanic origin. So if the state were to make that available, we would be able to identify distribution of different vaccine types across the population. But it's going to require a concerted effort from state offices to be willing to share that information.
Well, thank you, Dean Luis Falcon, our moderator and discussant, as well as our presenters, Dr. Edwin Melendez, Dr. Kelsey Mangano, Dr. Josemier Mattei, and soon to be Dr. Natalie Rios, for tremendous presentations. Everybody should know that all of these presentations will be available in our website, centropr.100.cuny.edu, as well as recordings of the webinar.